Welcome to new anesthesia drugs. Drugs on the horizon, they're already here. This will actually be a discussion about actual real-life drugs, not drugs that have AZDL2-404453 type of acronyms, but actual real-name drugs that we're either going to see shortly, have just started emerging into the market, or drugs that are starting to have new applications into the anesthetic world. This is presented by Major Pete Stribbe. I appreciate your time listening, and I hope you learned something from this presentation. The hard part in anesthesia, and the hard part about the longer we do our art, the more we live in this comfort zone, this world of only using a few drugs or a few things. What I would encourage you to is, with this new pharmacological lecture, is to kind of explore some of the new drugs coming out. It doesn't replace some of the old mainstays. I mentioned earlier that this is really a great treatment, either first line if you've tried other things, or people with refractory post-operative nausea and vomiting, or post-discharge nausea and vomiting. You may want to keep this available for you. Once again, just as a review, I had mentioned earlier, it's also related, the side effects are related to long or prolonged uses of this drug. I need to mention to you, there are some adverse effects that patients experience with this, typically anemia, very rare cases of bradycardia, a lot of flatulence, which I guess the surgeon can deal with, hypotension on a rare effect, and then itching, and some noted with pyrexia. So once again, those are expensive, as 80 milligrams is about $125. Clemoprex coming out. It's a new calcium channel blocker. It's kind of like the Aladdin theory. It's got great cosmic powers, but very narrow window of benefit that we're going to see in the anesthetic world. This is a drug that I think you'll see some benefit more into the emergency room, maybe with neurosurgical patients or a carotid patient that you need quick blood pressure control, but we need to go to is one of the things you're going to need to know. It's going to make a world of difference in your patients. The school of thought then is that the local anesthetic interfere with the fatty acid transport into the mitochondria of the cardiac cells, which inhibit the heart from performing oxidative phosphorylation, and then this leads to the cardiac dysrhythmias. The most current thought pattern then is that this lipids provides an alternative place, kind of acts as a reservoir or a sink for the local anesthetics. Now remember, local anesthetics love sodium channels. They love sodium channels. Peripherally, they run to your nodes or vernier. They block 2 or 3 channels. You get a block from that. The patient's numb. In your heart, it runs right up there and it holds on and clamps down and doesn't let that heart function. The lipids then act as a sink, or they give it an alternative binding site that the local anesthetics can jump onto. Problem with this, though, is this is a cheap drug. Cost you about $6 to keep a bag of lipids in your back table or your cart.